Hello and welcome to Medical Edge. My name is Todd Barnes. This program is produced as a partnership between the Mayo Clinic and the City of Thornton. We hope every episode provides you with valuable health information for you and your family.
When you have a cancer diagnosis or an advanced cancer diagnosis, everything in your life starts to unravel.
For Cynthia Sycon, long-distance running is a perfect metaphor for being a breast cancer survivor. Getting there is accomplished one step at a time.
It's very important, whether you're running a marathon or going through chemotherapy, to not think too much, just to focus on what you're trying to do right then and keep doing it.
I would recommend that anyone you know who's making the cancer journey have a buncologist.
Along the way, Sycon has found that others are inspired by her experiences. She talks about why she runs so tenaciously and about her diagnosis in 2010, which doctors in her hometown of Chicago repeatedly missed for over a year.
You have to be your own advocate.
This tumor could have been seen if one simple, different view had been done in mammography.
The latest scans show she's now cancer-free. Moving forward is about moving. A recent survey of Mayo cancer patients found that doctor-approved exercise decreases fatigue and boosts mood. Sycon's oncologist told her, if you want to run, run.
And time again, it turned out that I actually felt better if I stuck to my normal activity than if I just sat on the couch and wallowed in the discomfort.
For Cynthia Sycon, this seems to be the right medicine. For Mayo Clinic, I'm Dennis Stoda.
The medical team in this intensive care unit at Mayo Clinic is on high alert 24/7, watching for signs of sepsis.
Sepsis is a potentially life-threatening complication related to an infection.
Dr. Kenan Ramar says every year close to 750,000 people in the U.S. develop a septic reaction. It happens when an infection prompts the immune system to kick into overdrive, causing problems such as kidney failure, liver failure, severe drops in blood pressure, and even death.
It becomes very important that this is recognized early.
That's because the death rate can be very high, up to 75% for people who develop sepsis at home and up to 25% for those who get it in the hospital.
It's almost similar to treating a heart attack or a stroke, where you have a very short window.
That window is 6 hours. Dr. Ramar's team uses what are called sepsis sniffers, technology that monitors things like fever, heart rate, and blood pressure, and alerts the medical team when a patient's in danger.
Okay, I think let's go ahead and activate the sepsis response team.
We have a patient in room number 20. We want to activate the SRT.
If blood tests confirm that's true, the septic response team launches into action.
It's a big multidisciplinary approach to do this. And so all members of the ICU team are actively involved to get this aggressive resuscitation going and to get all things done within that 6-hour window period. Let's get the central line ready.
We did give a dose down in the ED, so continue with that.
We follow what we call as the Surviving Sepsis resuscitation guidelines.
Methods of best practice developed by the Society of Critical Care Medicine to ensure the best possible treatment for patients.
If the necessary things are done, then the mortality drops down dramatically.
Sniffing out sepsis and saving lives. For Mayo Clinic News Network, I'm Vivian Williams. A sleep study is one of the key tests doctors use to diagnose a condition called obesity hypoventilation syndrome, or OHS.
So obesity hypoventilation syndrome is a condition where people with greater than ideal body weight perpetually underbreathe.
Dr. Eric Olson says OHS is more dramatic at night, but it's also present during the day. It can happen to people who are obese with a BMI of 30 or more because their bodies can't compensate for the stress of the extra weight. Oxygen levels go down and carbon dioxide levels go up. Over the short term, OHS, which is often accompanied by obstructive sleep apnea, causes poor sleep, headaches, daytime sleepiness, and a general feeling of being unwell.
Over the long haul, you start to get complications primarily related to the heart.
As oxygen levels drop, vessels in the lungs constrict, making it hard for the right side of the heart to pump blood from the extremities back to the lungs for oxygenation. Over time, the right ventricle becomes enlarged and eventually wears out, causing heart failure. If you're diagnosed with OHS, it's important to get on the right treatment, and that involves using a positive airway pressure device, either CPAP or a bi-level pressure device. CPAP, which is also used for sleep apnea, keeps the throat open when you sleep by providing continuous inward flowing air pressure. A bi-level device boosts the breath taken by the patient. The bigger the breath, the more oxygen goes in and the more carbon dioxide goes out. A sleep study can help determine the appropriate PAP device and settings.
So patients who start PAP therapy feel better very quickly.
Dr. Olson says you should see a healthcare provider if you're obese and have symptoms that include snoring, halted breathing at night, waking up at night, daytime drowsiness, swollen legs, or shortness of breath. The right treatment can help you get a better night's sleep and therefore a better quality of life. For the Mayo Clinic News Network, I'm Vivian Williams. Disaster zones and battlefields can be difficult, confusing places. Medics make quick decisions about triaging the wounded. Some life-threatening injuries are obvious, but if a soldier is bleeding internally, there's no easy way to tell.
So there's a kind of a gradual response where your body compensates, followed by a sudden decompensation.
Dr. Michael Joyner and his research team at Mayo Clinic are studying how the body responds to blood loss.
The purpose of this experiment is to help the Army develop better monitors to determine who needs a transfusion and who doesn't need a transfusion in battlefield or trauma situations.
Triaging the wounded can be difficult because when someone loses blood, vital signs such as blood pressure and heart rate don't change much until the victim suddenly collapses.
So what we're trying to do is determine if we can predict when the vital signs are becoming unstable,
so they can intervene in time and save lives. The study, funded by the Department of Defense, includes 2 phases. First, the research team slowly and in a very controlled manner removes blood from a test subject.
We're going to take about a liter of blood.
That's about 20% of total blood volume.
And that is typically about where some people start to decompensate.
Then they put the blood back in and start phase 2. This involves putting the test subject into a negative pressure box. The negative pressure makes it difficult for blood to flow back to the heart, so it pools in the legs. The amount of blood that reaches the brain and heart decreases, mimicking blood loss. The researchers say if the body responds to the negative pressure the same way it responds to actual blood loss, they can do more experiments without having to take blood from patients' bodies. The information they gather will be used to develop monitoring devices that will hopefully help determine who needs immediate medical attention on and off of the battlefield.
So that when we're working with trauma victims or people in the operating room, we can figure out who needs blood when. And the goal is to make sure the patients do well during surgery and to make sure that we give blood to the right patient when and don't give too much blood or too little.
For the Mayo Clinic News Network, I'm Vivian Williams.
That's all for this episode of Medical Edge. If you're interested in learning more about any of the stories featured on this program, you can find additional resources by visiting our website and following the link to the Mayo Clinic. Thanks for watching, and be sure to watch the next episode of Medical Edge from the City of Thornton.